Now, I'm by nature a critical person. Are you able to prove the therapy successes of quantum medicine by suitable references? QRS is able to prove after more than 10 years of applications a long history of clinical tests, studies and research. Here you can see the cuttings from our research board. Here you can find numerous internationally famous universities and institutes like the Technical University in Munich, which at the time was still under the direction of co-developer Professor Dr. Koenig, or the University in Belgrade under the direction of Professor Dr. Jovanovic, who has the Professorship for Medical Technology and Cybernetics. But we're especially proud of our cooperation with Professor Dr. R.O. Becker from the Upstate Medical Center of the University in New York. He belongs to the pioneers of the electric biology, and the regenerative research was even suggested for the Nobel Prize of Medicine. An impressive list. To support the validity of the results reported until now, I would like to invite another guest, Mr. Professor Rainer Pelker. Mr. Professor Pelker, you've had a professorship at the University of the German Arms in Munich, and now you're leading the Institute for Applied Statistics, IAS. Is it right that you have carried out own studies with QRS? Actually, you are no doctor. Scientific research in medicine, like in public health, nowadays needs a highly interdisciplinary cooperation. In the area of therapy studies, this means without mutual cooperation between doctors and biometricians, that means statistics with additional medical knowledge, a study can't be carried out successfully anymore. In the context of my 25 years old research experiences in the areas of medicine and health research, I have consulted, accompanied studies, or looked like a chief responsibly evaluated and also written numerous publications about them, for example, as member of the German Society for Pharmaceutical Medicine or the International Biometrics Society. Also in the area of the magnetic field research, you have initiated, accompanied, or evaluated studies. Here, on the right side, we can see some published studies in which you partly participated. To which studies did these diagnoses refer to? The first studies about the magnetic field therapy, which were accompanied or initiated by myself, always in narrow cooperation with suitable specialists, refer to diagnosis of toncephalalgia, migraine, insomnia, and even one about erectile dysfunction, in general more known as impotence. All my evaluations showed after a therapy duration of approximately 4 weeks to 3 months obvious results of a substantial therapy success. All studies were controlled, that means randomized and double-blind, corresponding to a high scientific standard. Difficulty for a bright appreciation was the lack of useful explanation models of the active principle, and also the not observable diagnostic range of other therapies. Meanwhile, research is one step ahead. The number of appropriately successful studies has increased, so that this therapy form has reached a quite high grade of appreciation and acceptance under some diagnosis areas. In the meantime, I myself have continued researching and carried out some other studies with QRS. Although all important questions aren't clarified at all, and although I demand furthermore strong research supplies, including methodically clean therapy studies, the present results convince me in such a big way that I myself have also been using QRS daily and preventively for many years. And I can't complain about my health. So why does QRS work in such a various way, Mr. Dr. Krapf? Let's take the active principle for the increase of the tissue blood circulation. This is a benefit for impotences, which are arteriosclerotic or diabetes conditions. QRS also has influence on the vegetative nervous system, so the application of QRS against headache, migraine, or also insomnia seems reasonable. Because of the statistical studies evaluated by myself, I can confirm that their results with theoretical considerations of Dr. Krapf are wholesome. Mr. Professor Pelker, can you tell us another concrete example of a therapy success with QRS? Very interesting. All significant findings in randomized double-blind studies with QRS concerned the following diagnosis areas: osteoporosis, reduction of the osseous dismantling rate compared to placebo; gonarthrosis, clear reduction of knee pain with simultaneous improvement of the knee function and the walking performance; tumor, especially breast cancer, reduction, that means improvement of the oxidative stress, but also increase in performance in the preventive area of a fitness study, lactate reduction and improvement of the body balance.